Hello students, welcome back to Health Nursing. My name is Esther Filippo. So in our endocrine system disorders, we're going to be looking at thyroid disorders in this video. We're going to be looking at hyperthyroidism versus hypothyroidism. So what I want us to see in this video is the thyroid gland. So it sits around the neck area right here. It looks butterfly shaped and it is just below your larynx, which is your voice box. So the thyroid gland secretes thyroid hormones. It secretes your T3 and your T4. It also secretes your calcitonin, and what that does is it lowers the calcium level in your blood. But today we're going to be focusing on T3 and T4, which are the main hormones that the thyroid gland secretes. And what do? They help with your metabolism, your growth, and so many other cellular activities in the body. One of the things that is very important to your diet so that you make sure you're producing enough thyroid hormone is iodine. It ensures that your thyroid hormone production is on point. Okay, so what we're going to go ahead and do is look at hyperthyroidism versus hyperthyroidism side by side. So when we say hyper, it means that the thyroid gland is secreting too much. Okay, and hypo, it is secreting too little. All right. So another name that you might hear that refers to hyperthyroidism is Graves' disease. Sometimes you might also hear the word exothalamic goiter or thyrotoxicosis. Those are all the similar terms that pretty much means that your thyroid hormone is secreting too much. There's an overproduction. All right. Hypothyroidism, on the other hand, is low production of thyroid hormone by the thyroid gland. Other names that you might find with this is maxedema, which is a severe case of hypothyroidism in adults, and the word cretinism is congenital hypothyroidism. Congenital means that this child is born with this case of hypothyroidism. So is it that the child was born with it or it develops very shortly after birth? All right. So we're going to look next at the clinical manifestations of hyperthyroidism versus hypothyroidism. So with hyperthyroidism, because your thyroid hormone helps with metabolism, it helps with growth and things like that. When you're secreting too much of it, your metabolism system is very fast. So the patient tends to lose weight faster and they have weight loss. On the other end, with hypothyroidism, they will have weight gain because they're not secreting enough thyroid hormone, so they tend to gain weight and their metabolism is low. Okay. Other things you might see in hypothyroidism is a high heart rate and blood pressure, again, because of the excessive thyroid hormone that is being secreted. On the other hand, because of low thyroid hormone that has been secreted in hypothyroidism, you would have low heart rate and low BP. Also, going back to hypothyroidism, we have agitation, restlessness, nervousness, irritability, insomnia. This patient might not be able to sleep because there's just so much hyperactivity going on. The reverse is the case with hypothyroidism, where you have sluggishness, weakness, and fatigue. You would also have diarrhea with hypothyroidism. You would have bulging eyes, also known as exothalamus. So if you look at the picture, this man's eyes are popping, they're bulging. So this is a classic case that this man might have hyperthyroidism. In hypothyroidism, we have brittle hair and nails. Pretty much their hairs are not like looking really healthy. They're breaking easily. And finally, for hypothyroidism, these patients are often intolerant to heat, meaning that if they're in an environment that is hot, the temperature is really high, they're going to be sweating profusely. They really can't tolerate it. It's too much for them. And that's because their metabolism is already so fast. So if you put them in a hot place, it's just too much. On the other hand, someone who has hypothyroidism, they cannot tolerate cold places. So if you put them in a place that is cold, they will be very shivering. So you need to kind of like switch the environment you put each person. For an hypothyroidism patient, they'll be more comfortable in a colder environment. And for an hypothyroidism patient, they'll be more comfortable in a warmer environment. Okay. The next thing we're looking at is medical management. Now, how do we fix this issue? So, if our patient has hyperthyroidism, one of the first things the doctor might want to do is an ablation therapy using radioactive iodine. So, before we even think about surgery, we're going to use radiation iodine instead to ablate excessive thyroid hormone secretion, which is the gold standard, is our first go-to. But if that doesn't work, the doctor might introduce some anti-thyroid medication. So we have PTU, also known as propyl uracil, and we also have metimazole, also known as tapazole. So these two medications, what they do is they're anti-thyroid, so they will inhibit the production of your thyroid hormone. However, a patient might have a situation whereby these two procedures are not working, they're not effective, they're still producing so much thyroid hormone. Then we're gonna get to our last resort, which is surgery. So we can do a subtotal thyroidectomy. A subtotal is when we take out half of the thyroid, like you can see in the picture, instead of taking out the whole thing. Because if we take out the entire thyroid hormone, then this patient is going to become hypothyroidic. Even with the fact that we just took out just a little, this patient might become hypothyroidic. So we're going to take out just half of it, which is usually the go-to. Now, moving on to hypothyroidism, the go-to treatment for this is levothyroxine. Remember, the problem with your hypothyroidic patient is that they don't have enough thyroid hormone being secreted. So what they need is for it to be replaced. So we're gonna give them a synthetic version of it, which is pretty much what levothyroxine is. It's you pretty much taking thyroid in pill form. All right, you don't have enough thyroid, take it. So the doctor would order levothyroxine, which is the generic name for this medication. The trade name is called Synthroid. All right. So now, few things you gotta know about this medication and you gotta teach your patient about is that they take this medication once a day, first thing in the morning on empty stomach. All right. And you want to teach them that they should observe for signs of hyperthyroidism, because the thing is, now they're taking this thyroid hormone in pill form every day, every day, every day. There's a possible chance of overdose at some point. By the time it might get too much in your system. So once they start seeing symptoms of hyperthyroidism, so if they see symptoms like weight loss, they're having agitation, they're having diarrhea, their eyes are bulging, that might mean that, okay, you're taking too much Synthroid. We might need to dial down the dose. So you want to teach your patient to watch out for that. If they notice any of those symptoms of hyperthyroidism, which are also some adverse effects of levothyroxine, they want to report that to their physician. All right. Also, because this patient's thyroid level is low, they will have to be on this medication for a lifetime. So it's typically a lifelong treatment, and you shouldn't stop taking it. That's something you want to teach your patient without talking to their healthcare provider. Okay? And honestly, that is pretty much it with hypothyroidism. The treatment is pretty straightforward. However, before we round up, we need to talk about a few more things about hyperthyroidism, especially about that thyroidectomy I told us about. So, remember, one of the last go to treatment is surgery, which is a partial removal of some of the thyroid. Now, that procedure comes with some complications that you want to watch out for should your patient get it. So, four possible complications that your patient might have after a thyroidectomy. Number one is a laryngeal nerve damage. So, remember when we first started this video, I mentioned to you that the thyroid is just right below the larynx, which is your voice box, which is why if we go ahead and cut off just a portion of our thyroid, because of the proximity, there is a potential that the doctor might have accidentally touched the laryngeal nerve and cause some little bit of damage or a nick to it. So that's something you want to watch out for. I'll talk more in detail about this as we go on. But another possible complication is hemorrhage. So this patient has the potential to definitely bleed because we just cut off half of their thyroid. The third complication is called a thyroid storm. And the fourth one is hypocalcemia. So what we're going to do is go ahead and look at each of these complications individually more in depth. We're going to start with laryngeal nerve damage. Pretty much it's most likely that while the doctor was in there, taking out a portion of the thyroid, they probably nicked the nerve a little bit. But trust me, out of all the complications we're going to talk about, this is the least of your concern. All right. All the patient really needs is a voiced rest for the next 48 hours or so. Just tell them not to try to talk much, just be chill and keep quiet, pretty much. However, every 2 to 4 hours, you go to the patient's room and do a voice check. You can tell them to say, ah, and what you're looking out for is, do they have excessive hoarseness or voice change? But a little bit of slight hoarseness is expected and is honestly not a cause for alarm. So just keep monitoring this patient and reassure them that they're going to be fine. All right. However, the next one we're going to look at is hemorrhage. This is a big one, of course. You know, when someone is bleeding, it's huge. In the early stage, if there's a sign that they're bleeding internally, because the thyroid is an internal structure, right? So if they're bleeding there, you would most likely not see it externally. So some signs that someone is bleeding internally is that they're restless, they're a little bit apprehensive, their heart rate definitely goes up, blood pressure comes down, and they might tell you that they feel a bit of like a feeling of fullness around their neck area. If they say something like that, that is huge. And later, as this bleeding continues for a long time, they're gonna start turning blue. So you're gonna see cyanosis. All right. So what do you do? And how can you prevent this? When you go to the patient's room, every time you're doing your post-op check, you want to check the dressing around their neck, because most likely they will have a dressing in that area. Check for any obvious external bleeding. So you have to know that the patient is laying down and the dressing might be clean, look nice. However, because of gravity, all the blood is actually collecting behind your neck. So it's just rolling down, rolling down. So you might need to roll them and check behind your neck and your sides to make sure that the blood, if they are bleeding, is not back there. So you can be certain that truly this patient is not bleeding. And if they are, we can catch it early. All right. The next complication we're going to look at, which is a pretty big one, is hypocalcemia, low calcium. So you might be wondering, why would someone have low calcium after we take out a thyroid? Well, it is because of the relationship between your thyroid and your parathyroid. We're going to talk about parathyroid in the next video, so you can watch out for that. Okay, so please subscribe, turn on your notification bell so you don't miss when a new video drops. Okay. So back to this, the relationship between your thyroid and your parathyroid is, looking at this picture on the screen. You see your thyroid, which is the red butterfly shaped structure. But then do you see the orange little dots on top of it, the four dots? Those are your parathyroids. Okay, so they are behind your thyroid. So there's four of them. So you can imagine that if the doctor cuts half of the thyroid away, because the parathyroids are attached to the back of the thyroid, inevitably the doctor has also removed at least two of the parathyroids. And what do your parathyroids do? They help you with the production of calcium. So that is why, if half of the thyroid is cut away, which is thyroidectomy, there's a potential that the patient's calcium production level might drop, which will cause hypocalcemia. Okay, low calcium level. Now, why is this a big deal? Some of the symptoms you might see when someone has low calcium level is tetany. So, some signs of tetany is your chivastic sign. So, if you touch the patient's cheek, they might have a bit of facial spasms going on there. So we call that the chivastic sign. And if you put a blood pressure curve on their arm and you pump that all the way up, they might have some carpal spasm. All right, we call those carpal spasms, also known as Trousers signs. All right, so those are two really big tetany signs. Other ones are paresthesia, which is that numbness and tingling feeling that they might have. Now, the worst symptom that you definitely want to look out for is laryngeal spasm. Because of low calcium level, your larynx might also close up. So if you look at the picture on the bottom left, the larynx are supposed to be open like that, all right? So that way air is able to come out and you're able to have that voice. So you have your nose, you have your pharynx, which is your throat. So air goes through and air passes through the larynx. enters the trachea so you can breathe. But if the larynx close, aka spasm, air coming in through your nose, down your throat, will not pass through your larynx and enter your lungs. What would that happen? So that means you're not breathing. Okay, so that will cause an upper airway obstruction, and you're gonna hear a sound called stridor. Anytime we hear stridor, that is huge. All right. It's an upper airway obstruction. Air is not getting all the way to your lungs, and that is bad. So that has become an emergency. Okay. But one of the things we would do if we suspect that our patient is having tetany, before it progresses all the way to laryngeal spasm because of low calcium level, is we can give calcium. All right. Because the problem is they don't have enough calcium being produced. So we'll give something like calcium gluconate via IV. All right. So that is the third complication of a thyroidectomy. The final one is called a thyroid storm. Now, a thyroid storm is, I want you to think of if you had a plate of cookie, you pick up the cookie and you break the cookie into two, you snap it into two. So think of that. We have our full thyroid and we cut it and we snapped it into two. So we took out half of it and left half of it. But the process of you breaking a cookie into two, what just happened? You're going to have crumbs that will drop on your plate. So something like that also. When we cut this thyroid into half, we're going to have bits of thyroid hormones sprinkle and drop into the bloodstream. So that is like you have an exaggerated symptoms of hyperthyroidism because there is a whole lot of thyroid hormone that has just been released into the system, which is why we call it a thyroid storm. So it can happen within the first 12 hours after a thyroidectomy. This patient is going to have nausea, vomiting, their heart rate is going to be through the roof, blood pressure through the roof, and they are going to be really running a fever. So hyperthermia. So it's really bad. Really, what we can do is just, treat the symptom, watch the patient, and wait for all that excessive thyroid in the system to just die down. So we give IV fluids, we give corticosteroids, we give antipyretics for the fever, and we give anti-thyroid medication, so your PTU or your metimazole, to reduce the thyroid hormone that has been released into the system. And if needed, we're going to give oxygens to make sure this patient keeps breathing. All right. So those are the complications that can happen due to a thyroidectomy when we're trying to treat someone with hyperthyroidism. To round this up, we're going to look at some nursing interventions for both cases. So for hyperthyroidism, you want to make sure this patient is eating good. All right. They need foods that are high in protein, vitamins, especially your B vitamins, minerals, carbs, because they're so hyper, their metabolism is so high. So they're not losing weight back to back. You want to make sure that they stay on top of their food intake. They need calcium and vitamin D to prevent osteoporosis, especially after a thyroidectomy, whereby half of the parathyroid has been removed. Soft, easy to choose food so that they can swallow, because some of your hyperthyroidism patients suffer from dysphagia. Also, these patients are already hyper enough. They don't need coffee, tea, Coca-Cola, things that have caffeine in them, because it's just going to make them more hyper and irritable and all of that. So the opposite for your hypothyroidism patient, you want to prevent chilling during bathing. Remember, we said they are intolerant to cold. So they can get very cold and chill while you're bathing them. So you want to make sure the temperature of the water stays warm. They might need extra time to take care of themselves to get things done because they're very slow and just weak. So don't try to, rush them. They need stool softeners or lactative because they might get constipated every now and then because their metabolism system is just slow. Peristalsis is slow. They also need that high protein, high fiber, but a low caloric diet because they already have a tendency of weight gain. All right. And they definitely need to drink a lot of water. They need to increase their intake of iodine. Remember at the beginning, I told you that iodine is very key in your diet for production of thyroid hormones. So they need to stay on top of that. And you can find iodine in like your fish, your milk, your eggs, your iodine salt, and of course, increasing food in fluid intake, like I said earlier, to help prevent constipation. patient. So that is actually all about thyroid hormone disorders, hyperthyroidism versus hypothyroidism. And I really hope that this was impactful and helpful for you. I will see you on the next video. Please make sure you subscribe, hit that notification bell, and make sure you share this video with someone. God bless you. Bye bye.